amanzi yi-problem ba yi-problem sibile ebhengo lapha amanzi ayasihlupha kakhulu sivuka ngo-4 siyesaba ukuvuka ngo-1 ngoba uyabusesesa ukuthi sahlangana lokunye ngcono ngivuke ngo-4 ngoba abantu basebezwakala bekhuluma ezigojweni ngo-4 sibili sizothatha amanzi ngabona vele kwedlula u-4 uthi asukuma ngo-5 noma ngo-6 vela usela amanzi athola amanzi sephelile.
This is the situation facing rural women and the girl child in Zimbabwe who bear the responsibility for water collection in the majority of rural households. Whilst access to safe and clean drinking water and adequate sanitation is a basic human right, essential for achieving sustainable development and poverty alleviation, access rates in Zimbabwe's rural areas remain low. Despite significant efforts to develop the rural water supply infrastructure in Zimbabwe, rural populations still face challenges in accessing safe and portable water and proper sanitation facilities. Without strategies to ensure access to safe water and sanitation, rural communities will continue to face outbreaks of diseases, continuing poverty, and negative impacts on livelihoods. In Zimbabwe, the maintenance and management of rural water supply facilities has been the preserve of the District Development Fund, or DDF, and the rural district councils. Since the attainment of independence in 1980, the country made great strides in developing an expanded program of delivering a rural water supply service, which saw an increase in water facilities in rural areas. However, due to political and economic challenges from 2000 onwards, there was a rapid decline in water and sanitation infrastructure in these areas. The result has been increased pressure on the few functional water points that are shared by both humans and livestock, and water rationing is now being practiced. It also increases the workload of women and the girl child as they have to walk longer distances and spend many hours fetching water, leaving little time to spend on other productive activities such as income-generating projects and schooling, amongst other activities. This has necessitated the move to adopt innovative approaches such as community-based management of water supply facilities. Community management of water resources is a participatory approach to development where members of the community largely determine issues to do with the control, operation, management and maintenance of their water systems. Reduced participation of rural communities in water management and their understanding of the acts governing them affect their contribution in management of the catchment and sub-catchment council. It is against this background that Practical Action Southern Africa, in partnership with Moroti or Sechaba, implemented the Enhancing Community Participation in Governance of Water and Sanitation Service Delivery in Rural Gwanda District project in 15 wards of Gwanda District in Matabeleland South Province. Funded by the European Union, the 3-year project, which ended in August 2013, aimed to contribute towards democratization in the management and governance of communal water and sanitation infrastructure in Zimbabwe.
The Gwanda Water Governance Project that was being implemented over the past 3 years sought to improve community participation in the management of their water resources. Firstly, the first objective was to ensure communities plan with the stakeholders what they feel, or they create their vision towards implementing of the project, especially when we're looking at issues to do with water and sanitation. The other objective was also to capacity build district stakeholders so that they are key in the implementation of the water and sanitation project, especially when the project comes to an end like it is now.
But the specific challenges that this project wanted to address were: one, underwater, wanted to address the challenge of having few water pump mechanics as well as pump minders. Then two, to address the issue that most of the water points in the district were non-functional, either due to shortage of the spare parts or that they were dry. Then, in as far as sanitation is concerned, Gwanda district has got a low sanitation coverage, and as such, we wanted to alleviate this by training toilet builders who would in future build toilets for the people.
Gwanda district has a total 24 wards and lies in regions 4 and 5 with annual rainfall of less than 600 millimeters per annum. There are few perennial rivers in the district, making underground water the only reliable source of water. This situation creates a high dependency on water, both by animals and humans, implying that management of the groundwater supplies is of critical importance. With project work conducted in 15 wards in the district, the project succeeded in strengthening the participation and role of rural-based grassroots and civil society organizations in the delivery and governance of water and sanitation services in the district. Grassroots-based and civil society organizations in Gwanda district are now properly constituted with organized structures and have improved capacity to plan their work, thereby contributing to decision and policy making in integrated water and sanitation services.
From the year 2000, when the government of Zimbabwe decided to decentralize water management and did set up catchment councils and sub-catchment councils, the thrust was to take the management of water to the end users. But unfortunately, people were not aware that the management of water had been brought to them. Right. So when Practical Action and Moriti came on the ground with this particular project, they then partnered together with Shashi Sub-Catchment Council in taking the information to the people, in taking the word to the people to say the responsibility to look after water is now with the end user.
Kungakabi le project le emroti le practical action ama committees ayekhona but bengakwazi ukuthi besebenza besuka ngabesiya lanxa isikolo singeze sife siyahlala 2 years bengakwazi ukuthi bakwenza but kathesi ngalokho ukufundisa i-workshop abangenise khona hayi sokungcono.
Ngibona isitshintshile into eziningi kakhulu ngenxa yokuthi abantu vele besingazi izinto eziningi ngenxa ye-program le sesibona kutshintshile ikakhulu endaweni njengezikojo. Mina ngithabele kakhulu amanzi, besipho kuya kukha nje amanzi sithi isikojo, kodwa kwenele ukuthi bona abaya iprogram la ingene khona sesikwazi ukuthi kumele kube smart lapho sikha khona amanzi. Lama committees bekunganama committee kungaqedakala esikojo, sesikwazi ukuthi isikojo ngesikojo kumele sibe le committee ukwenza ukuthi kusebenzeke kuhle. So sesibona kutshintshile okumangalisayo besincedisile and siyayibonga sibili kakhulu iprogram le.
The communities in the target wards now have increased understanding of the legal instruments that are central to water and sanitation delivery. These legal instruments were translated into local languages for easy understanding by the communities.
Kunemfundiso sayitholayo ku project esasingayazi noma nje siza kamizi singakwazi, okutshengisa ukuthi njengokuthi nxa kunje ngaba lesikojo emzini wami ayisiso sami amanzi asowami kodwa insimbi ezinye zami amanzi ayalelwa umuntu, so asoze uyalela abantu amanzi ukuthi khona isikojo lesingesama kuvumakala emthethweni ukuthi uyabotsha, so besingakwazi khona oku, so yikho sikufundileyo.
One of the key project successes has been improved community-driven water and sanitation service delivery through good quality technical knowledge and equipment supplied by the project. Activities under this component were to consolidate the concept of community-based management, or CBM, empowering the beneficiary communities to have control, full authority and responsibility for the development of water and sanitation services. User communities in the target wards have taken responsibility for the operations and maintenance of the facilities and all obligations such as raising resources for spares and upkeep. As part of the process of improving community-driven water and sanitation service delivery, the project trained pump mechanics in borehole rehabilitations, leading to effective maintenance and management of the water facilities. Latrine builders were also trained in the construction of upgradable Blair ventilated pit latrines.
The project registered quite a number of successes. Within it, we had boreholes that were rehabilitated within this project, close to 50 boreholes. We trained pump mechanics, close to the same number, about 40-something, 45 or so pump mechanics, and also these pump mechanics were given equipment to repair the broken down boreholes. That also increased the sustainability of the project within the project area, because those pump mechanics, up to now, they still do without us. And we also want to acknowledge our relationships with the government, DDF, District Development Fund, for their input in training the pump mechanics, and Ministry of Health and Child Welfare also their input in training, especially in the toilet construction. The environmental health technicians were doing that.
We are now realizing a reduction in the downtime of some water points, whereby when a water point breaks down, it now takes a shorter time for it to be repaired, because we now have people who are trained in that. Also, they are equipped with some tools to do the repairs, and also the community is now better mobilized to take charge of their own water point problems.
Mrs. Isora Mwe, a resident of Ntalale in Gwanda's Ward 11, actively carries out her routine tasks as a village pump minder. She is part of 32 pump mechanics trained by the project and represents a new breed of pump minders who have broken the barrier in a field largely dominated by men. Her work has seen the reduction in the number of non-functional water points in Talale.
Umsebenzi ka-pump minder ngokulungisa izikotsho. Ukulungisa izikotsho khona phe ema-village ethu sekwatrainwa abanye okuthiwa ngabomakanika bema-village. Mina ezingu-pump minder labana bangaba nekunye okuba ihlulileyo babuya kimi bezombiza ngibe sengisiya batshengisa ukuthi hayi isikotshwe nxa sinje kasisilungiseni sisithi. Imfundiso engayithola kakhulu ku-project yena leyo basithatha basihambisa ukuyatrainwa ngo-2012 emanama. Safika satrainwa sibili ulwazi lwakhona babevele belokhu beqalisa phambili kolunye lolwana obengilalo. Sahamba sisiyalungisa ezinye izikotsho bona bekhona silokho sitrainwa sitshengiswa labanye sibili ukuthi lapha nalaphana phela nxa usentweni awusozowathi into yonke uyayikwanisa. Ufunda kwabanye sathi sikhona ngale silokho sezifundweni ifundo okuningi sibili kakhulu kwangicedayo lami ukuthi sengifike ezikotshweni zami ngiyenze njani.
28-year-old Mbonisi Moyo now looks forward to putting his recently acquired skills as a latrine builder trained under the project to use. He is also expected to construct latrines for other community members in his ward as a way of improving his livelihood through the income earned from construction activities.
Project lapha benefite into eziningi kakhulu ngithole ukuthi sengine experience ekuyakhela ama-toilet. Bengisazi ukuyakha ama-toilet but bengingawazi ama-measurements amaningi, the way esithole ngakho ulwazi kathesi lapho lwehlukene kakhulu lwazi ebesilwazi lesilufundiswa ezikole ema-colleges. Engikuthandayo futhi ukuthi ayiyakhiwa umuntu wonke nje, yakhiwa umuntu otrainileyo. So if utrainile kuthi ukuthi usulolifa lakho lempilo yakho yonke, ngoba nxa utrainile uzokwakha. Every time ngakuthiwa kuyakhiwa ama-toilets ngoza utholakala lapho usakhala ku-toilet.
Improving the response of district-level state actors to effectively and efficiently respond to community, water and sanitation demands was a key activity within the project. This has seen the resuscitation of the Gwanda District Water and Sanitation Subcommittee and creation of linkages for effective delivery of water and sanitation services in the district.
At district level, the project did resuscitate the DWISC, which is an acronym for the District Water and Sanitation Subcommittee. This was achieved through the assistance of the Provincial Water and Sanitation Subcommittee, which trained members of the DWISC on their roles in the particular project. Now they are making decisions. For example, to say that they are the ones now that have an input to as to which wards one could operate in as far as water sanitation projects are concerned, and also they are the ones that monitor the projects under water and sanitation, and also they also are responsible for quality control in as far as the materials that are to be used in water and sanitation projects are concerned within the district.
The Ministry of Health and Childcare is one of the government ministries who are part of the District Water and Sanitation Subcommittee.
The activity that we're involved in is the training of water point committees, whereby we are saying every water point should have a committee managing that point, being responsible for the maintenance, mobilization of the community for any repairs that are needed, so that assists in reducing the downtime of any given water point, and ensures that people have a constant supply of clean water, and that contributes to the reduction of waterborne diseases. And the other area where we're involved is in the training of latrine builders, where we identify community members who undergo some training in the construction of latrine. We had our partner Muriti and Practical Action providing the materials for the building, the cement and the tools for the builders, and that helped some members of the community, especially the vulnerable ones, to benefit from the training where the latrines were built in their homes, and also the builders are left with some skill and some tools to continue providing the skill to the community for any member who wants to construct a latrine on self-reliance.
Innovative knowledge development and dissemination techniques were also implemented through podcasting, a digital extension approach which led to the dissemination of demand-led knowledge resources in local languages in the target wards. This component involved collaboration with members of the District Water and Sanitation Subcommittee to develop knowledge content in local languages. The knowledge is disseminated by community-based knowledge workers through MP3 devices.
We also had one peculiar activity that we did, podcasting, and I think for us, Moretti and Practical Action, it was, we were like the first organization, or the first two organizations in the area to do that, compared to other NGOs that were working in Gwanda. This podcasting project managed to increase knowledge of water, knowledge of sanitation, but then we also expanded it to increase general knowledge to the public to improve their health and livelihoods. So it was a very good project. The knowledge workers that were trained were really pro the project, because they would go around in the areas and really podcast, that kind of issues, and people would come up with their own issues which they needed more information on, and we addressed those.
ngingu-knowledge worker wendawo yenale 117. Ezifundweni zami ngahamba kule practical action demurudi babe bemfundisa. Safunda uku-operator imchini ababesinikeze yona okuyi-MP3 le-speaker. Sathatha i-training ye-3 days. Hayi sabakwazi ukuyenza imchina lokuthi abantu kumele babe nolwazi benganikezwa ukudla kodwa banikezwe ulwazi lokwenza ukuthi badle. Abantu esengibafundisile baningi kakhulu ukuthi ngiyakwanisa ukuthi umhlangano owodwa kube labantu abafikayo abo 300 mawungowe ward mawungowe village ngiyabe ngilabo 180 kodwa i-average yami esikhathini esiningi kuba ngo-80 abantu engiyabe ngilabo ku-village meeting. Ngoba umtshina lo kukhanya bawuthakazelela kakhulu ukusebenza kwawo ngoba bathi information ebuya ngomtshina it's better than ebuya ngomuntu ngoba kayitshintshi ibuya injalo lapho eyabe ikhulunywe khona.
Some key lessons have been learned during the implementation of the project.
We found that working very well with the government departments makes the project progress in a quicker pace, because they took it as their own now. When they were planning, they took it into their plans. And then also having dialogue with community leaders is very key, because the moment they understand the project, when they take it down to the communities, it's easier for the communities to accept it. It's easier for them to align to that, because already their superiors have aligned.
Consultation is key in project delivery. Through consultations with other organizations that have got experience in the implementation of that sort of program is key. You can also consult through maybe exchange visits, where you are going to learn from what other districts are doing or what other countries are doing.
Involvement of the community in the project cycle is very important in the sense that it can lead to sustainability. Hence, communities were involved in each and every stage of the project. And also, to say that communities should be the ones that are driving the project, rather than for the partner or some organization to drive the project. And in this sense, we had builders from other wards training our latrine builders. So on that on its own,
the Water Governance Project has aptly demonstrated that increasing citizen participation and improving governance of the sector promotes sustainable access to water and sanitation for rural communities. The lessons that have emerged from the implementation of the project provide valuable insights for the decentralization of delivery of essential infrastructure services in the water and sanitation sector. In view of the fact that most water sources are communally owned, it is essential that any rural water policies for such areas should ensure optimum community participation in planning and implementation. If the right policies on water development are adopted and implemented, Zimbabwe will be in a better position to address access to safe and clean drinking water as a basic human right, leading to the achievement of gender equality, sustainable development, and poverty alleviation.